One of the questions that we get a lot from clients is about their water breaking and when that's going to happen. And basically, depending on when your water breaks during labor, you have some options available to you. So there's basically 3 types of water breaking scenarios. One is premature rupture of membranes, which is also called PROM, and that happens when a woman's water breaks and she's not having contractions. So not to be confused with premature as in a premature baby. If the water breaks and the woman is preterm, meaning her baby is before 37 weeks gestation, and she's not having contractions, then it's actually called PROM. But we're not going to actually talk much about that today. We're just going to talk about PROM right now. So if that happens, you will have a few options depending on your provider. Your provider may tell you to just wait it out and see what happens. So for most women, if their water breaks and they're not having contractions, they will ultimately start to have contractions within about 24 hours. Of course, there's variation. So for some women, it will be much more immediate, and for other women, it could take a little bit longer. And some of that advice may depend on whether or not you're GBS positive. So we know that women who are GBS positive may have a small but serious risk of passing on GBS or group B strep to their baby, and the water breaking and there not being contractions for a long period of time actually increases some of the risks associated with that. So your provider, another thing your provider may offer if you have PROM is that you could come into the hospital and just be observed there. So they may monitor the baby, they may check your temperature, just kind of see how things are going. Keep an eye on you until contractions do start on their own. The third option that your provider may recommend is having you come in and augmenting the labor. So giving you medications to get the labor started, or using some other measures to start contractions, which could be things like breast pump or castor oil. If you're going the medication route, it would be things like usually Pitocin if your water is broken, but potentially other things like Cytotec could also be used. The other time that your water would break would be during a spontaneous rupture of membranes, or SROM, which is when the water basically just breaks on its own. You've already been in labor, you've already been having contractions, and ultimately the pressure on that bag of water just causes it to break. So with that, usually you don't have too many options available. It's usually one of those things that just kind of happens on its own, but depending on where you are in the labor, it could influence how the labor goes. So, sometimes if you're already 8 or 9 centimeters when that happens, your labor may actually start to progress even faster and things may become more intense. Or if you're earlier in the process, then your provider may just be extra careful watching you and your baby for signs of infection, because if if your water breaks, even if you're already having contractions and you still have some time left to go, then they just want to make sure that you're not getting an infection. The third time that your water may break would be an artificial rupture of membranes, which is when your provider actually breaks your water for you. And so how that looks is your provider would use something called an amni hook, which is basically a stick with a tiny little hook at the end, but it's curved so that you won't have any injury to your body when they're inserting this hook. They're gonna it'll feel just like a vaginal exam, so they'll use that hook to just kind of catch a little bit of the amniotic bag and break it. And so reasons that your provider may do that would be, if labor wasn't progressing for whatever reason, that could be something that could release some prostaglandins and kind of help to stimulate more contractions. They may also do that just as a standard measure. So for some providers, when you get admitted to the hospital, they just break your water as part of their standard of care, and that could also be true for induction of labor. So some providers, as part of the induction process, just want to break your water to just kind of help to get everything moving and kind of get the baby's head down onto your cervix.